Hi, my name is Melanie Aguilar. Transcatheter mitral valve repair in patients with heart failure. Definition: the heart has four valves that cause blood to flow in the right direction. In some cases, one or more of the valves do not open or close properly. This can cause the flow of blood through your heart to your body interrupted.
The prognosis in patients with heart failure and secondary mitral regurgitation is poor, although surgical mitral valve repair and replacement have not been shown to reduce hospitalizations or death. Transcatheter mitral valve repair may improve clinical outcomes. In this multicenter randomized controlled open-label trial, 614 patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy were randomized to transcatheter mitral valve repair plus medical therapy or to medical therapy alone. The primary efficacy endpoint was all hospitalizations for heart failure within 24 months. The primary safety endpoint was freedom from device-related complications at 12 months. A key pre-specified secondary endpoint was all-cause mortality within 24 months. The annualized rate of all hospitalizations for heart failure within 24 months was significantly lower in the device group than in the control group. At 12 months of follow-up, 96.6% of patients in the intervention group were free of device-related complications, exceeding a pre-specified threshold. All-cause mortality within 24 months was lower in the device group than in the control group. The authors conclude that among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy, transcatheter mitral valve repair may improve clinical outcomes. Full trial results are available at any
Application in nursing. China they prepare venous line and administer serum therapy and necessary medication. Monitor and watch vital signs. Prepare and evaluate the material to carry of the technique. We perform venous and arterial hemostasis. Monitor the appearance of complications.
In 2003, I developed a virus in my left ventricle of my heart. And that's when I met Dr. Jaski at the San Diego Cardiac Clinic and his team. And I've been working with them ever since until this wonderful new procedure came on to help cure my mitral regurgitation.
So heart valves are just like doors inside the heart. They allow blood to exchange from the top portion of the heart to the bottom portion of the heart, and then to let the blood out of the heart. And traditionally, we would replace that heart valve with open heart surgery. This new heart valve is put in through a small tube that comes in through the tip of the heart. We make a small incision between the ribs, it's around this wide, and then we put in a new heart valve through that incision.
So what they did, Dr. Galiputi felt that I was a good candidate to go in through under the left breast area and kind of deploy, if you will, a little spear gun.
This technology is amazing. It requires a lot of people. You'll see in the room, there's maybe 15 people in the room to set it up and to make it. And then there's this big, long harpoon, it looks like. It's putting a whole new heart valve in through a small tube.
So on June 30th, I went in for the surgery and I woke up with the new mitral valve.
At Sharp Memorial, we've had a history of having innovation here. We've been the first in San Diego to have heart transplant, left ventricular assist device, open heart surgery, and we continue to offer all of the newest innovative strategies to help out with both heart valve technology as well as heart care overall.
And I really felt that if this could help science and advancement, and personally, if I had any chance at living longer, I wanted to take it. I have a husband I love. I have
Pros and cons. Pros: halo sufficient laminar flow and close of the cardiac apex by means of the patch, avoiding bleeding and complication. Cons: bleeding, blood clots, valvular diffusion in replaced valves, heart rate problem.
One of the structural and interventional cardiologists here at Virginia Cardiovascular Specialists. And in this video today, I'd like to discuss MitraClip or transcatheter mitral valve repair to treat severe mitral regurgitation. Mitral regurgitation can be identified in a number of ways. Sometimes it's when a patient's doctor hears a murmur and then they obtain an echo which demonstrates that they have a leaky mitral valve. But oftentimes it becomes noticed because of symptoms. And so the symptoms of mitral regurgitation are very similar actually to the symptoms of aortic stenosis. And so these would include things like fatigue, problems breathing or shortness of breath, and also patients can develop symptoms of heart failure. Mitral regurgitation can happen for a number of reasons, and we kind of put it into two different categories. One is when the mitral valve itself degenerates. Over time, as it opens and closes with each heartbeat, the valve itself can become thickened and the support structures of the valve can degenerate and the valve itself can become abnormal. And when that happens, you can have a leaky mitral valve. More recently, studies looking at patients that have a normal valve, but the heart itself is weakened to the point where it can no longer support adequate closure of the mitral valve. And this is a group of patients with what we call functional or secondary mitral regurgitation. We do this procedure under general anesthesia. Once the patient is asleep, we put a catheter into the vein in their groin, and then this is how we deliver the device to the mitral valve. When this becomes severe and a patient is symptomatic, we can use
applied in Ecuador. In Ecuador, the impact of cardiovascular disease is quite significant. It is estimated that around 14% of the Ecuador population lives with some heart disease. Of this, it is estimated that more than 199,000 have heart failure. Transcatheter mitral repair results in a lower rate and hospitalization for heart failure and lower all-cause mortality within
In a healthy heart, blood flows in one direction through the heart's chambers. Delicate tissue-like structures called valves function to ensure unidirectional blood flow within. The heart has 4 such valves which regulate direction of the blood flow. The mitral valve separates the left atrium from the left ventricle and is made up of 2 thin flexible flaps called leaflets. When freshly oxygenated blood from the lungs returns to the heart, it enters the heart through the left atrium. Left atrium relaxation causes the mitral valve to open, enabling blood to travel into the left ventricle. When the left ventricle contracts, the mitral valve closes to prevent backflow. In some people, the mitral valve doesn't close tightly, causing mitral valve regurgitation. When the heart beats during contraction, the blood from the left ventricle can flow back up to the left atrium. Mitral regurgitation, MR, can be subdivided into functional and degenerative subtypes. Degenerative MR, or primary, results from anatomical abnormalities of the valve itself. In most cases, the chordae connecting the mitral valve to the papillary muscle rupture or elongate, causing leaflet prolapse. MR is a progressive disease which, if left untreated, can initiate a series of events culminating in heart failure and death. Current guidelines recommend surgical mitral valve repair or replacement in severe MR patients. For MR patients for whom surgery is not an option, minimally invasive procedures are available. MitraClip is a unique, highly maneuverable transcatheter system for mitral valve repair. This procedure avoids cardiopulmonary bypass using minimally invasive venous approach and transseptal puncture to gain access to the left atrium. MitraClip's steerable guide catheter is introduced over a previously placed guide wire. The dilator is used to gradually advance the guide into the left atrium.